My name is Dave Bess. I'm from Las Cruces, New Mexico. I'm retired. And I had a stroke about 15 months ago there in southern New Mexico. And our stroke care is about 10 to 15 years behind the national standards for stroke protocol and stroke care. So fortunately, I was able to recover on my own after 2 hours. I was completely paralyzed on one side, completely blind in one eye, unable to talk, and even unable to think for a solid 2 hours. When I came out of it and they finally then began to do some of the diagnostics that should have happened upon my entry to the emergency room, of course I was able to pretty much fully recover. I'm thankful for that. And yet, as we travel around to other states and find out the quality of stroke care across the country, one of the things I'm trying to do here in Washington is advocate for more adequate health care that meets the needs of all of our populations. And we do have some health care disparities, especially stroke care in New Mexico.
I had an uncle who owned a trucking company, and his wife had diabetes. He suffered with high blood pressure and blockage in his arteries because he was a heavy smoker. Ended up, he only had just a really lame and cheap and bare bones kind of insurance plan. And at first his wife got sick and she needed an amputation of her leg. His insurance did not cover that. Later on down the line, he ended up needing amputation of one of his limbs also because of his blockage. His insurance didn't cover that either, of course. And so that led to the loss of his business, the loss of his home, and all of his funds were bankrupt, all because of not having adequate insurance to cover the needs.
My name is DeBruycker. I'm from Wilmer, Minnesota, and I'm a registered nurse. And I've been involved in the Heart Association for a number of years as a volunteer as a nurse. But this year, these issues speak to me more dearly and personally than any other issue I've ever been involved in. We talk about adequacy of care and access and affordability, and I witnessed that firsthand with my daughter. My daughter was diagnosed with bone cancer when she was 19. She was young, she was a college student getting on with her life. And I thought I understood healthcare. I thought we had good healthcare insurance. And realizing what happens when you have a rare disease that makes you go out of network, what those deductibles cost, what without a cap, I'm still paying bills. My daughter died 6 years ago. And one of the things she wanted was this to be different for other people. My daughter's Megan.
Megan?
Yes, and she's passionate and bright and all those things you want people to be. And I can't help but mourn the good things she could have done in her life. And I come today because it's got to be different for other people.
His name is Brendan, and he had a stroke before he was born, and I'm here on behalf of him, speaking for him because he's 4 and he doesn't have a voice yet to speak out for himself. I am very frustrated with healthcare as it is right now, and I want to see positive improvements for him so he can be covered and no longer be underinsured. I want him to be adequately insured so he can continue on with treatments, which he's getting treatment. However, as an adult, he's going to have to suffer and be faced with having to pay out of his pocket for what he needs.
I'm Jeremy Alyward from Sioux Falls, South Dakota. I'm an accountant full-time with a firm in South Dakota. In 7th grade, I was diagnosed with a heart defect, which required surgery eventually. We just didn't know when. At 18, I underwent my first open heart surgery, and 20 days later, they did emergency surgery. Since then, I've had quite a few insurance battles that I fought through. Number one, they didn't feel that some of the amounts charged or billed by the hospital for the initial surgeries were required. So they said that was all out-of-pocket expense for us. We argued on that battle and finally won, but not until I had everything put into collections, and I was 18, so it all went on my credit record. Then in 2006, after I started back to school and was working towards my degree, the insurance company dropped me. I couldn't find affordable or adequate coverage that would cover what I needed or that I could personally afford to pay for. And I didn't want to go back to my parents and ask for help because they had already spent the money to help me with the initial surgeries, and I have other brothers and sisters at home that they had to also take care of. So I struggled, made the choice not to go without insurance, pay for out-of-pocket expenses all on my own. Then in 2007, I graduated college and thought my insurance struggles were over being under a group plan, but that wasn't true. They placed a rider on me, as well as a medical waiting period, which meant that I wasn't going to be covered for almost 2 years. So again, I was paying out of pocket and struggling to make ends meet all while I worked multiple jobs and just tried to live on a daily basis. So that's why I'm here today. It's something that needs to be heard. I don't think they realize how many issues are out there with people that can't find the coverage needed.
My son Luke was born with 4 separate heart defects, and since then I became affiliated with the American Heart Association, and I guess trying to get the word out that heart disease is not just an elderly issue.
I'm Michelle Newman. I'm from West Bloomfield, Michigan, and I'm here to share my story. As a survivor, 7 years ago, I was surviving cancer and basal cell carcinoma when I developed a very rare central nervous system vasculitis. I stroked out, had seizures, became paralyzed, and I'm a miracle to be here. Because of family and faith and good health insurance, I'm here to tell my story.
Mike Nelson. I'm from a little town called Norwich, Ohio. It's outside of Zanesville, Ohio. And I'm self-employed. I have a small picture framing business. And my story actually started in 1996. I was diagnosed with cardiac disease, blockage. I went through heart surgery. I had a quadruple bypass and got through it. And 2 years after that, I lost my job, a 6-figured income with a food service company. And I lost it due to health reasons because we were a self-insured company, and self-insured people do not like to have risk people on their payroll. So I was basically uninsurable at that time. I had the insurance through the Cobra plan for 18 months, lost it, and then I was basically unemployable and uninsurable.